Welcome back to HIP, Health Insurance Personalized, so-called consumer-driven personalized healthcare. This is Consumer's Doctor on the behalf of Foremost Organization. You all know, we want choice. Choice of the doctor, choice of the hospital, choice of the facilities. We all want choice. But do you understand there are forces working against your interest? We all want choice, We all want freedom in healthcare. But there are forces working against your interests. I'll go into details. What are those forces? There are secrets of health insurance affordability. You know the tricks and lies they use. There is a public-private free market-based solution, folks. Public-private free market-based solutions that is consumer-driven and patient-centric. We would love to have that. Let me go into the details what these secrets are. There are 18 secrets, folks. I'll go one by one. Secret number 1. Insurance is based on a concept of risk pooling. On the risk pooling. That is sharing a potential risk. Sharing a potential risk. Like medical costs with a large group of individuals with similar health status or health risks. So that is number 1. What is number 2? We would like to have the risk pooling based on our health condition, but it's not happening. It's not being done right now. What is number 2 secret? There are 28 million Americans in 2019 without health insurance. Most are working for small employers. Most want to offer affordable, small employers want to offer affordable health insurance to their employees and families. That is not happening. Nobody is focusing on the smaller employers, folks. Number 3, secret number 3, folks. Politicians are rarely interested in focusing health insurance needs of small group or individuals. They're rarely interested in smaller groups. These are the bread and butter of our industry, small employer groups. They're not interested in that. That's a big secret, folks. That's a big secret. They're not interested in this small mom and pop employers. They want to provide insurance for the employees, but nobody's interested in that. What is secret number 4? Segmenting individuals by health status or health risks is the key to affordable health insurance and access to healthcare. Segmenting the individuals based on their health status. This simple and obvious concept is frequently missing in most of the health reform proposals, folks. We are not segmenting the risks. What is secret number 5? Vast majority of the population would enjoy lower premiums if high risks were segmented into a separate pools. provided a proper care and treatment for their health circumstances. Some given state and federal premium subsidies, and everyone offered information support related to their conditions. So segmenting those individuals will make a big difference. Majority of the folks will have lower premiums by segmenting the high risk individuals. What is number 6? Health insurance and laws. This is a beauty. Health insurance laws and regulations were mostly written by health insurance industry lobbyists and lawyers. Consumers are generally ignored in this legislative process. This is a sad state of affairs, folks. Consumers have been ignored. That's a big secret, folks. Consumers have been ignored. What is secret number 7? Lobbyists and vested interests will preserve the status quo and work against your interest in choices, treatment options, and affordable insurance. That's a big secret, folks. They want to preserve the status quo. What is secret number 8? 90% of the hospitals don't know their costs to provide services. This is really sad. Healthcare costs are a classic example of collusion and price fixing by industry insiders and government complicity in that aspect. Government complicity on that aspect. That's a secret number 8. What is the next big secret? Number 9, comprehensive solutions. This is a beauty. Comprehensive solution is a tactic used by the industry lobbyists to delay, deny, and defeat consumer-oriented, patient-centric healthcare reform solutions. They're being denied because that's the tactic they use, folks. Comprehensive solutions used by the industry lobbyists to delay and deny and defeat consumer-oriented, patient-centric healthcare reform solutions. What is the next big secret? Secret number 10, segmenting uninsurable individuals with impaired health conditions can lower the premiums for individual policies and small group contracts by 15 to 20%, folks. 15 to 20%. I'm not kidding on that. Just by segmentation alone, segmenting the impaired health conditions, you can lower the premium for most of the small group individuals contracts. What is secret number 11? Segmenting similar health status or health risk will allow personalized care, treatment options, and information support that will lower unnecessary use of medical services and reduce the premiums, folks. Reduce the premiums. That's a secret number 11. What is the secret number 12? Wow. Secret number 12. Health insurance is only one way to finance health insurance services, folks. That's only one way. Other financing options are savings and earned health insurance rewards, the other financing. But health insurance is the only way to finance it. Only way to finance it. That's a big secret, folks. And number 13, secret number 13, similar group risks can affect lower premiums with reduced overall use of medical services. Yes, reduced overall use of medical services by putting them in a similar group. Individuals with account-based plans can share lower medical costs with rewards and incentives. That's secret number 13. And these health insurance account-based plans like health savings account, health reimbursement accounts can be used as a tax advantage accumulations of funds to pay for cost sharing features of insurance like deductibles, co-pays, and insurance. So the HSAs and HRAs funds can be used for the deductibles, co-pays, insurance, and drugs, pharmaceuticals, yes, medications, yes. What is secret number 14? Health insurance rewards of 30% or more of premiums can be earned by compliance with insurance program incentives. That's the beauty, folks. These rewards, 30% or more premiums can be earned by compliance with insurance company rewards, program rewards. That's a big secret, folks. What is the next big secret? Number 15, concept of this health review authority empowers consumers, levels the playing field with insurers or insurance companies, and guarantees everyone access to insurance, folks, access to health insurance. This health review authority under the public-private partnership, it doesn't cost the government a penny, folks. It doesn't cost the government. That is a big secret, health review authority under the public-private. What is next big secret? Number 16, concept of certificate of guaranteed coverage is a hassle-free, market-based protection for pre-existing conditions, folks. For pre-existing conditions, yes. So that is it. What is the next big secret? Number 17, concept of subsidized impaired health support group, so-called impaired health support plans, assures affordable health insurance for all. Just the concept of impaired health support plans assures affordable health insurance for all Americans, folks, all Americans. What is the next big secret? Last but not the least, secret number 18, personalized health insurance adopts to all these features, folks. All these features solves the concerns raised and creates affordable health insurance for all Americans at a significantly less cost than Obamacare. Less cost than Obamacare, folks. This is where, Obamacare is purely mandatory, like you mandate top-down approach. But this here, it is purely voluntary. If a person doesn't have the health insurance, there are consequences, folks. There are consequences. If people don't buy health insurance, under Obamacare, people can abuse the system and claim to use the Obamacare under the false pretense, where under the voluntary system, if a person does not buy health insurance, there are consequences. They lose the exemptions, tax exemptions. As a result, state and federal government can accumulate, can collect more revenues to help to support impaired health support plan. That money goes to the impaired health support plans, folks. That's how we are able to support that. And when the consumers are involved, I can bet you will see it like any other retail and food industry. When consumers driven healthcare costs, ultimately the costs of healthcare delivery will go down. Ultimately, consumers are the only category can lower the cost. Look at how free enterprise system is working in America, in retail and groceries and food chains, and even in restaurants. But when it comes to healthcare, I am not sure why we are so hesitant for consumers to control the healthcare costs. They have been ignored, and it's a time consumers need to be empowered. The only way it can be done by creating a health review authority under the public-private partnership. So-called personal care accounts are created through health savings, health reimbursement accounts, so consumers can pay as we go. And the beauty about healthcare, technology is on the consumer side, folks. This mobile technology is going to revolutionize the healthcare delivery. I know we have gone through so much through COVID, but one benefit I see is telehealth, telemedicine, and mobile technology is going to take over the healthcare. So we don't have to wait in the doctor's offices. We don't need to wait in the emergency rooms. So ultimately, consumers will be able to pay as they receive the care. That's the beauty of having consumer-driven, personalized healthcare. Thank you for listening. As a consumer's doctor, I love you guys. I work for you, and I'm purely a volunteer for the foremost organization. I would like to see consumer healthcare delivery succeed. Ultimately, we all can get freedom in healthcare. Thank you, guys. Thank you for listening. If you do like this channel, subscribe, share, and hit that bell. Hit that bell. Goodbye, and I salute you all. We'll see you in the next episode of Personalized Healthcare.